Good afternoon, everyone, and thank you, Laila Madam and KSOS organizers for this opportunity. I'll be speaking on evaluation of white pupil and to find out whether it is cataract, because cataract is the most common problem that we see in a white pupil. So, talking about white pupil or a leukocoria, it is an abnormal reflex coming from the pupil. It can start from the pupillary plane to the retina. So the lesion can be anywhere there. So this is one assessment that you have to do in an infant. If you don't do anything else, if you can just do a red glow testing, that's more than enough. So what is the ideal situation? So ideal situation is a proper normal red glow from both the eyes, which has to be almost comparable. And this itself can make you rest assured that there is nothing great, much significant in the visual axis. Now coming to the various factors or various pathologies that can produce a white glow in the pupillary area are so as I mentioned, how can you assess the level? So it can be something from the pupillary plane to the retina. So ideally you should be able to do a proper slit lamp examination, either with a handheld slit lamp if the child is very small, or the usual slit lamp examination, which itself will give you a clue as to the position of this white glow. So it has to be a Bruckner's test and a slit lamp examination, which is a must. So let's go to various conditions which can cause a white reflex. This is not a white reflex, you can call it a brown reflex. Actually, this is at the pupillary plane, and this is a very aggressive persistent pupillary membrane. It may not cause that much of diminished vision because the child might see through a small area, but you can have a compensatory growth of the eye with very high myopia and associated amblyopia. So whenever there is a persistent pupillary membrane which is very aggressive, it is ideally you should be treating it, just removing it without injuring the lens capsule. Now coming to the most common things, common one that we see as a white glow, the commonest that we see are the cataracts. So cataracts like this is a total cataract in a child, which is not difficult to assess. Even then you need a proper slit lamp examination to see the amount of cortical involvement, capsular involvement, etc. If possible, it's ideal way to see the level of opacity. And these are the ones you might miss, especially they can be unilateral, like this is a typical posterior polar cataract, which you might miss if you don't do a red glow test properly. So in such cases, even though it is a small one in the center, it may need treatment because it causes severe amblyopia. And yet again, these conditions, unilateral, you can see the typical PHPV. It's an anterior PHPV with the fishtailing like posteriorly. You can see that stump of the PHPV and the central cataract, and all these can show as a white glow in the pupillary axis. Now coming to this condition, like again came as a white, referred as cataract, but you can see there is some amount of difference in the cataract. The corneal diameter is little on the lower side, not that bad, and you can see that fibrosed capsule, and on slit lamp we could make out that it is not just a typical cataract, and difficult to remove the capsule. You have fibrosed capsule and it's being excised. And definitely there is cataract, but in such cases, unilateral cases, you have to suspect something posteriorly. Obviously, we will do a B scan in all cases, but it may not be evident in all the B scans in children. And there is a cortical cataract here, but once the cataract is removed, you can see that typical feature of, this is a dangerous looking PHPV. It is a PHPV. It's an anterior PHPV which looks like which has got a vasculature like that of a retina. So it is ideally, it would be better for the anterior segment surgeon not to touch it, because there can be folds of retina involved in this. So I stopped the surgery with this, and obviously it was an anterior PHPV with a fold of retina in it, and we got the help of the retinal surgeon for the central excision of this area, which can be quite vascular too. So once we go out of the lens plane, it's actually not your territory, but still you can make your diagnosis. Like in infancy, the next thing that you can see is an absorbing vitreous hemorrhage. Many a times the child get referred to you as ROP, but you have to see them properly. And vitreous hemorrhage is not that rare, especially if they have had a traumatic labor. You can have vitreous hemorrhage, and in the absorbing stage, it can present as a white glow. So it may be difficult to see the posterior vasculature in such cases, but you have to do a B scan, and serial examination is extremely important to be sure that the underlying retina is okay. So vitreous hemorrhage is yet another condition that you see. And next is a coloboma, which is actually a congenital one. So such cases, when involving the macula and the disc, the results are usually not that good, and they come with a red glow, and there can be associated anterior segment associations also, like an iris coloboma. Now this is something that you don't want to see, that is retinopathy of prematurity of stages 4 or 5, which is an offense. Actually, we shouldn't be seeing cases like this, but still we do see sometimes with patients referred to us at 3 or 4 months of age, a premature born, and the excuse would be like they couldn't do an examination because the child was very sick in the NICU, so a proper examination was not done, or maybe there was a sudden progression in between, the child was sick, and it was obviously they wouldn't be able to examine the child properly. So this is something that should never happen, because extremely difficult to treat and the results could be difficult. Now coming to other conditions like toxocara uveitis, when it is involving the posterior pole, you can have granulomas, which can also present as a white glow. And Coats disease, it may not be there in infancy, but because of the subretinal exudates and the retinal vascular changes, all these goes into the posterior segment surgeon's territory, but still you can make a diagnosis when the patient comes with this particular complaints. And familial exudative vitreoretinopathy is yet another condition where the white glow may not be that significant depending upon the grades. And this also, again, you need a posterior segment help for all this. So this is a child who presented to us 2 weeks back. With the parents were noticing a white glow since about, they say, 4 months, when photographs were being taken unilaterally, and they were no squint, nothing, and they brought the child, and this is the by the time the child reached us, this you can see the typical retinoblastoma with all the vitreous seedings. All these are features that you feel so bad to explain to the patient. Patient was not referred as cataract, but these are the situations where you find it very difficult to explain to the parents as to the grave conditions that they have to face. So like pupillary plane and crystalline lens level, white glows are more amenable to treatment. As you go posteriorly, it's little difficult, and the vision threat is more as the level of white glow recedes posteriorly, and any abnormal pupillary glow warrants immediate attention. Thank you.
Thank you, Dr.